Hey, hi everyone, and welcome back to another session by Fit with Cura. In this session, especially, what we are going to do is we are going to understand how to prevent postural back pain. Now, this is one of the very crucial factor. Reason being that right now India's mean age is about 35. In next 5 years' time, most of the Indians will be in their 40s. Now, what that means is the possibility of having postural back pain is going to go up by at least 30 to 35% in next 5 years. And which is why understanding that how to prevent the lower back issues is extremely crucial. And this session is all about that. So let me quickly share my screen with you. And we start digging into understanding that how the postural lower back pain can be avoided. Point number one. And what are the ergonomics or daily habits which you can on a regular basis follow so that your spine remains healthy. Now, why it matters. You will ask me, okay, why it is important? Like I already mentioned that, most of the Indians possibilities they're going to suffer from backache. Apart from that, there are many misconceptions onto thinking that, that whenever back pain happens, we will see to it. Okay, the problem is your back starts whispering way too earlier. Okay, it gives you at least 1.5 to 2 years time when you're having that nagging pain, nagging discomfort on and all, but you do ignore it. And when it starts screaming, you feel that, oh God, my back is hurting so badly and I can't really take care of it, right? And that is usually people end up having missed work days. Now, homemakers, students, professionals, no one is immune from it. Anyone can suffer. Okay. And which is why it is not any specific profession which is going to have more discomfort. But understand one thing that anyone who sits for a longer time is more prone for getting it. Why? Because human spine is designed in such a way so that we can stand, walk, right? You can imagine that we were all quadruped animals. We used to stand on four legs, right? Now we have acquired this posture where now we stand on two legs, and now our spine, which was actually horizontal to the gravity, has now become straight, erect. Now that means the anti-gravity muscles are being used extensively in order to for us to move around, to sit, right? To walk, to stand, right? So all these are postural muscles. That means these muscles are being used in an anti-gravity position. But because of our lifestyle, we are using them extensively into a sitting position, and that is one of the largest and the biggest reason why the postural backaches happen. Now, as a physiotherapist, our duty is not to just treat your back pains, but also to let you know that how you can prevent it. Okay, because back pain, postural back pain, is 100% preventable. Note that down, right? So, let me share one a real life story, one of our patients. Like I told you, that this specially affects professions or people who happen to sit for longer time. This young gentleman in his 30s, Mr. Ramesh, he was an IT professional and he had come to us with severe back pain, and that was basically induced because of this chronic sitting. He used to sit for about 8 to 9 hours a day. Now, considering our clinic is in Pune, Maharashtra, we have lot many IT hubs here. And even apart from sitting at workstation, he had to also sit around in his car because of traffic. So you can imagine that 8 to 9 hours of work and plus travel time, it used to go to almost 12 hours per day, which is huge. He had tried medications. He had tried supplements. He had tried injections, but nothing was working. So when he came to us at Cura, we realized that his posture was off the mark. He was not taking micro breaks. He was not doing the right kinds of movement which he was supposed to do. And at the same time, he was worse, was not even aware of in which postures he was sitting or moving around. Now we took care of all these three things, and the result was there was no surgery needed, and he actually started having a pain-free work days, which is huge for a person like Ramesh who is in his 30s. His life is just starting, he's just advancing his career, he's just thinking about his personal and career growth. To have a back pain can be a huge restriction into career growth and a life growth. So we can just say that, okay, it's a lower back pain. No, it's not just a lower back pain. Understand one thing: when the physical problems stay for a longer time, they become a barrier in life. And so we need to fix them at the right time. Now, moving on to what causes postural back pain. Like I told you, that prolonged sitting is the most common cause. Even there are few professions which would require a lot of standing, right? So people like, who are working in boutiques and salons, or police, right? Or professions wherein, the sales are there. All these professionals need to stand for a very long time, and that can also be a problem. But comparatively to sitting, the problems are lesser with standing. Of course, if you are having a standing work desk, some know that that is going to be the next question in your mind. If you're going to have a standing work desk, you have to see to it that you're mixing standing and sitting durations. The reason why we sit is actually because we save up to about 20% of our energy. See, most of the times the urban lifestyle is like we do all brainy work, right? We don't have any physical work. So we would sit down, think, prepare for our work. It is something which is related to your mind. Your brain is functional rather than your body, right? So if you are standing and doing that work, that is going to consume a lot of energy, and which is why we sit, correct? Now, when we are sitting, 20% of energy is saved, but then it is causing a lot of other problems, and which is why you have to mix these standing and sitting postures. Very crucial for you. Now, if the posture is wrong, if the posture is slouched, or if there is a poor alignment into it, it is going to give you a trouble. Correct? So, with these 2 points, it's very important or very crucial to note it down that if your posture is prolonged or if your posture is wrong, then it is going to give you back pain. And imagine if it's both. If you are in a poor posture and if you are sitting for longer time, then 100% guarantee that there would be a back pain sometime in your life. Now, if you act early, naturally this problem can be completely prevented, right? And which is why this session is very, very important. Now, this can also happen if your abdominals are weak core muscles, okay? Especially in India, if you've seen, people in about 35, 40, they start putting about a lot of belly fat. Hmm? Now, when the belly fat gets deposited, that is also one of the main core reason why the back pain starts. Glutes, that is buttock weakness, is also another reason why the lower back pain starts. Improper workstation, that is, you want to sit right, okay, you are aware of your postures, but your workstation is not helping you do that, can also be one of the important reason to have a back pain. And lastly, if you are in stress and if you are a shallow breather. Now, this particular session, we would not be able to cover the stress and lower back pain association, but I'll tell you what, there is a huge and a strong association, and I will be sharing a session onto that for sure. That's my promise. Because there are many a times all these things are checklisted, everything is fine, and still the patient is in pain. And then we have to really dig on to the emotional patterns, the lifestyle patterns, and then we get to know that where that stress or that pain is coming from. Okay, so don't miss on to that point for sure. Now, sitting posture fix. Now, this is This is very interesting. Now, what is happening over here is I'm first sharing a posture for a desktop. Now, the same posture can be used by students for writing, okay? Or if you are reading something, or if you are doing any embroidery or coloring work, some artwork, then also this posture will be very helpful. But right now, I'm keeping it easy, and I'm keeping it only for the desktop. Now, when you are using a desktop as or a table and a chair as your workstation, then there are a couple of points which we have to see to it. First and foremost, the neck has to be straight. The neck need not be bent completely or twisted or rotated to any of the side. It has to be straight. So whatever work you're doing, it should be in front of you. Like when I'm talking to you, my laptop is exactly in front of me. Now, second thing is the shoulders should be relaxed. There should not be shrugging of the shoulders, because if the shoulders are shrugged, what would happen? There will be tension in the neck muscles and the upper back muscles. The elbows should be rested on the armrest. Then the lower back should get a proper support. If you can see over here, it should have a proper support over here. Okay. If you feel that this gap is causing a discomfort, you can also take a lower back pillow. And the thighs should be straight, or the knee can be slightly lower compared to the hip level. Okay. Now make sure that the thigh level is either downward, the angle is either downward or it is straight. There are few plastic chairs which we usually see in few of the offices or few of the workplaces, that the person is actually sitting lower, okay, and the knees are higher. If that is the case, what happens is it puts a lot of pressure onto the lower back, and that is something which needs to be avoided, right? Now, with this, when the knees are slightly lower, the ankles need to be relaxed, and make sure that the feet are properly rested. If your feet are dangling, it is going to cause a problem with the circulation. And make sure, if only needed, go for a footrest. Now I'm saying if only needed, because if your thighs are already parallel to the floor, or if your knee is already lower than the hip level, then the footrest need not be there, or footrest height has to be very small. Sometimes we have seen in the offices, people just keep procuring footrest because it is available. And actually, what would happen with that? That knees would go higher than the hip level, and that will also cause a problem. And which is why it is important and crucial to understand that when and why you have to use these resources. Okay. Now, this is very interesting because many a times you would say that, say, we don't use desktops so much, but the use of laptop is more often or more common. In those cases, especially, make sure that you're not using laptop as a laptop for an extensive time. You are actually using a laptop razor, okay, and you are using a separate keyboard and a mouse. If that happens, technically what you have done is you have created a desktop again. But that is what is going to be helpful. Reason being, when you are using a laptop without any support, you can imagine the distance between the screen and the keyboard is extremely less, right? It is meant for easy carrying of a machine, right? But we use laptops now very extensively. That has become a part of it. Okay, many of the professionals don't even have desktops. Now, in those cases, it is extremely important that you start using a laptop with a razor and a separate keyboard. Now, with this, what would happen? Again, your the laptop screen will come at your eye level, so your neck will be relaxed, your shoulders would be relaxed, and the keyboard will be placed at the elbow height. If I just quickly go to a previous slide, you will realize that this is exactly what we had achieved when you were sitting with a desktop. Now, when you're using a laptop without all the support, that is, without the laptop razor or without the keyboard, what is going to happen? You are going to lean forward. So either now you bend your neck too much, Okay. Or if you say that, okay, I'll keep a laptop razor so that my neck will be straight. Now, in that case, what would happen? You will be shrugging your shoulders. So it will be actually a trade between whether you want a good posture for your neck or whether you want a good posture for your shoulders. So I think it is like, easily avoidable by just investing into a razor and a keyboard together, right? Now, this is a very, very crucial part, okay? Because people ask me that, okay, fine, like, but desk is already here. And not always the furniture changes are recommended or can't be done for whatever restrictions you may be having. तो फिर आप क्या करें, right? Most of the times you can imagine that, or we can very safely assume that getting a chair or replacing a chair is easier. Hmm? Even at home, if you have a work office, it would be a great idea to have a chair which is having adjustable seat height. Okay. Many a times people work from home, but they do not invest into an office setup. And I very strongly recommend you to do that. Okay. Uh, Consider this that, if you were to go to office every day, you will be actually spending a lot of money in traveling or commuting, and you are just putting that money aside and investing it into a desk. And that's extremely crucial because it's going to save your joints. Your joints are going to thank you later. Hmm? So do invest into adjustable seat height chair. And these are the 5 points which you have to see into an ergo chair. Which are these points? One is the seat height should be adjustable. Okay. Why this is a requirement? Because if the seat height is adjustable, what would happen? That you will be able to adjust the height of seat or you according to the fixed desk height, right? Then see to it that the armrests are adjustable, right? First and foremost, see to it that there are armrests of chair. And then if they are adjustable, that would be a great addition, because then what will happen is that once you have adjusted your chair height to the desk height, your elbows are in 90 degrees, they are coming exactly at the desk height, and what you're doing is you're comfortably resting your elbows now onto the armrest, correct? And if the armrest is not adjustable, what will happen? Either the elbows will be unsupported or you would be shrugging your shoulder. In both cases, we don't want that, right? Lumbar support. It has to have a good lower back support. There are few chairs which come with adjustable lumbar supports. That would be a great addition, but that would cost you a little higher. Dynamic recline. That's the fourth point and very crucial. What dynamic recline means? That your chair slightly moves backwards like this, and you can do these micro movements, and they are extremely crucial, because you would say that, okay, you have already told us not to sit in one position for a very long time, but sometimes the meetings only go on for an hour or 2 hours. Then what to do? In those times you need to do micro movements. Like if you have observed me right now, I'm doing few micro movements, like rotating the chair, then moving backward, moving the neck, slight arm movements. These are called micro movements. If you're not able to get up from your chair at all, at least start implementing these, because they are a lifesaver, I tell you. And lastly, the wheels. Why wheels? Because I don't want you to rotate your spine. Okay. Now, if I have to pick up anything from my right side, I will simply turn. Okay. Because my chair turns. Otherwise, what I would have to do, I will have to twist the back, and the back pain starts. You can imagine, like, if you have kept a few things on the right side and they are there and you need to reach out to them every now and then, imagine how many times you need to do that movement. And when that happens, the rotation and the back pain starts. And which is why you have to have these 5 points. Take a screenshot if you need to. Very important. This is a FAQ which we are asked in the clinic, that what to look for in an ergo chair. These are the points. If you have like all 5 tick marks, great, go ahead. No need to invest in very expensive chairs, but at least these 5 points should be there. Now, Like sitting for a longer time can give back pain, standing also for a longer time can give back pain, right? And so there are two important things that, if you're going to stand for a longer time, make sure that the weight is equally distributed, avoid leaning onto any of the side, and at the same time also make sure that you are wearing footwear or you're wearing support footwear which is going to have a good cushioning. Okay, so that is going to be a lifesaver again. Movement breaks. Now I love this because I'll tell you what, that in clinic we tell patients that you need to do exercises. Hmm? When they are in pain, they know that yes, they have to do it. Once they're out of pain, for few days they know they have to do it because that is what has given them comfort. Now 2 weeks, 3 weeks pass by and they forget about pain. Now once that happens, they now are not sure whether they have to do exercises, and now that's not a habit, and so they lose out onto it, and the pain recurs. This is because when you're doing exercises, your overall muscular strength is maintained, right? But now, if you're not doing those exercises and you're going to sit for a longer time, what would happen? There would be a muscle fatigue. So you're going into the same loop. Hmm? Postural aches are like that. They're very easy to treat, but the recurrence ratio is extremely high. And which is why the savior is this, which is micro breaks. So we advise our patients to take breaks every 30 to 45 minutes. Break as in not a coffee break or a smoking break, okay? Break means you have to stand, if possible, stretch your arms or move. These are all micro movements. Just do a little bit of wrist movement, neck movement, little bit of ankle, do some rotations, easy, easy movements. In fact, we do them every now and then when the back hurts or the back feels stiff. You just have to start doing them in a more structured way, that's all. But they can be extremely beneficial. Now, make sure that your mattress is firm, okay? And the mattress is about 5 inches thick. It shouldn't be smaller than that. And if you're using a cotton mattress, that's perfectly fine, but just make sure that it is now evened out. And uneven mattresses or rough mattresses can also give discomfort, and spring mattresses, of course, without a doubt, can be a problem because they do not support the contour of the spine, and so we have to make sure that we're not sleeping onto them. If you are having a mattress with a foam, then use a high density foam mattress. Okay. And if possible, if you like a little firm or firmer mattress, I don't know if there's a word like that. If there is a more firm mattress, uh, use a coir onto it. Okay, so when you're using a coir, what that does is it gives a good support, and your mattress will not sink down with your weight. So that can be one very important point. If you're sleeping on sides, if you have a habit of sleeping on sides only, then do take a pillow or small support between knees so that the back is not twisted. This is not for every day. This is especially if you're having a sore back or if you feel that you've been sitting or standing for a very long time. And with those early indicators of discomfort, you can work onto this. Now, how physiotherapy can help? Very important, because if you say that okay, fine, now I understood that how I can take care of my back, but if it has already happened, then what to do, what's next? So this slide is all about that. Okay, now first and foremost, physiotherapists can help you understanding that what is going wrong. Okay, and they can help you with the assessment and the correction of posture. See, ultimately, you have to understand that lower back pain is not your doctor's or physiotherapist's responsibility, because it is your postural problem. That means you have created it. That means you will have to solve it. Okay. What best physiotherapists can do is can give you ideas how you can improve onto postures. Are we clear onto this? Because most of the times people say that, okay, yeah, you gave me treatment, my pain went away. But now see, again, the pain has started. It will start if you don't change the habits. Because in the first place, it started because of the poor posture. It started because you are not moving. Then how your therapist can help you with relieving that? So keep in mind that your correction continues even after your pain goes off. Okay, and if this is the only point if you can take from this session, it's good enough for me, it's a win. Okay, then once the correction or posture correction is advised, we have to make sure that we give activation and strengthening exercises. What I told you, that this is an anti-gravity movement, right? That means your anti-gravity muscles should get activated. They should become stronger and they should support you for whatever long hours of sitting you do. Correct? So, which is why activation core strengthening becomes the second part of it. Now, the third part is matrix rhythm therapy. This is only for the cases which are chronic. Okay, this is a corrective action. So if you say that, okay, now my pain is okay, I'm not having that much pain, but I'm having stiffness, then what to do? See, another part can be you do stretches, foam rolling, massage, correct? But matrix rhythm therapy gives us an edge because it can actually help us targeting the areas of stiffnesses, and it reduces the stiffness to its deepest level. Now, after the release with matrix rhythm therapy, we can go for massages, we can go for muscle release techniques, we can go for foam rolling, we can go for cupping. All these are superficial releases. So we can definitely go ahead and do that. Okay. But understand one thing. Again, many patients take matrix rhythm therapy, they feel extremely better, and then they feel that their problem is vanished forever. That's not the case because you have to do something to continue with that flexibility, right? So that's why very crucial. It has to have, so, all these therapies you can consider they are more like a classwork. Hmm? And the exercises are going to be your homework. When you combine this, your muscles learn, right? Simple. Physiotherapists can also give you guidance onto movements and they can also give you guidance onto the ergonomics. And this all needs to be personalized because without that, things are not going to improve. Otherwise, there are a lot many YouTube videos for exercises. But which video is suitable for you? How will you know? You won't, right? And which is why doing this is extremely crucial. Now, to summarize all this, 4 quick points. Partial back pain is 100% preventable. Okay. Then you are focusing on to ergonomics, the way you sit, move, right? And you do the movements, which can be exercises or micro breaks. Then it is going to leave you with a healthy spine. Third, very, very important. Don't wait till the pain becomes chronic. If you're having nagging pain on and off, if you're having a discomfort in between, that can be a sign that, you have to start taking care of your back right away. And posture is a daily habit. It is not a one-time fix. It is like if you correct a posture and then you say that, okay, I don't have to think about it ever, okay, this is going to cause a problem because if you say that, okay, this month my salary has come, now I don't have to work any time in my life, what would happen? It won't work. It has to be a continuous process. Okay, just like how we go for wealth maintenance, this is a health maintenance, and we have to pay the price of working because you're using your body to work, right? The maintenance is very much needed. If you need to do more about what we do and more about how we do, you can reach out to us. We have clinics in Kothurud, Baudhan and Wakad area in Pune, and we are known for our holistic physiotherapy services and the matrix rhythm therapy and ergonomic services. Not only that, We also give you emotional healing therapies. For a few patients, like I told you, that stress can be one of the reason for back pain. This can be a savior, because I am also a certified emotional freedom technique coach, and I'm also a certified lifestyle burnout prevention coach. So we have combined all these therapies and we work on to this pain, this discomfort in a holistic way. So do stay tuned for more such sessions, more informative sessions, and drop a comment if you like this. Thank you.